What new UTI treatments are on the horizon? Imagine a future where urinary tract infections are easier to treat and less likely to come back. Recent medical advances are making that a real possibility. One of the most exciting developments is Gepotidacin, approved in 2025. It's the first new oral antibiotic for complicated urinary tract infections in nearly 30 years. Gepotidacin works differently from traditional antibiotics by blocking two enzymes bacteria need to multiply. This helps it fight common bacteria like Escherichia coli and Staphylococcus saprophyticus, even strains resistant to other drugs. Clinical trials with over 3,000 patients showed Gepotidacin to be as effective or better than nitrofurantoin, a standard UTI treatment. Side effects are usually mild, like diarrhea or nausea. It's approved for females aged 12 and older who weigh at least 40 kilograms. This new medication offers hope for those battling resistant infections, which are becoming more common worldwide. Another promising option is Pivmecillinam, approved by the Food and Drug Administration in 2024. It's an oral antibiotic from the penicillin family that has been used extensively in Europe for decades. Now it's available in the United States for complicated urinary tract infections. Clinical studies show it can cure between 60 to 72% of infections. Side effects tend to be mild, including nausea and diarrhea. Pivmecillinam provides a new first-line treatment, especially useful as resistance to other antibiotics increases. Recently, the Food and Drug Administration also approved Sulopenem, a new oral penem antibiotic. It adds another tool to fight complicated urinary tract infections, especially those resistant to traditional treatments. These new antibiotics are part of a broader effort to improve infection management and reduce the risk of antibiotic resistance. Guidelines for treating urinary tract infections are also evolving. Doctors now recommend shorter courses of antibiotics, usually 5 to 7 days, to help prevent resistance and minimize side effects. The focus is on choosing the right antibiotic that reaches effective levels in the urinary tract and tailoring treatment based on the specific bacteria involved. From a bladder health perspective, these advances are important because they help maintain bladder integrity and reduce chronic inflammation caused by repeated infections. When infections are effectively treated, the risk of complications like bladder damage or progression to bladder cancer can be lowered. Plus, preserving antibiotic effectiveness is crucial for vulnerable patients who may have underlying bladder conditions or a history of bladder cancer. While these new treatments are promising, they are meant to complement standard medical care, not replace it. If you experience symptoms of a urinary tract infection, it's essential to see a healthcare professional. They can diagnose the infection properly and recommend the most appropriate treatment based on your individual health needs. Remember, managing infections early and effectively supports overall bladder health and reduces the risk of more serious complications down the line. So, Gepotidacin, Pivmecillinam, and Sulopenem are paving the way for better, more targeted UTI treatments, giving hope for more effective management of these common infections in the future.